I just want to show you the distribution of the COVID cases by districts at the end of May. And you see some of the, Nakonde was on the border with Tanzania, was one of the hotspots, as well as around Lusaka and Kafua. This distribution also kind of coincides with the survey we did, which centers around the border areas and Lusaka. Currently, and this is the 30th of September, we're seeing at 15,000, nearing 15,000 cases. And then there's some 340 COVID or COVID-related deaths at the moment. However, we also know that it might be an underestimate because we have limited testing capacity. They're scaling up testing capacity as we speak. It's going to be more at district level as well. But the preliminary results of a serological survey conducted in July suggest that up to 1.8 million Zambians had contracted COVID up to 30th of June, which would be like 10% of the population. Of course, we all know there's a lot of research to be done to find out exactly what are behind these numbers. I think for us, as a context, it's really important to understand, also to understand the survey results is that really created a perfect storm for Zambia. Zambia's response to COVID-19 is really limited by underlying economic and structural constraints. We've got our financial challenges. Again, it's something Cecil will go into detail. We have limited state capacity and long-term underinvestment in healthcare, which also has undermined the response. And of course, importantly, funds for social sectors have been squeezed by high debt servicing costs and public wage bill. If you want to read more about political economy analysis of COVID, we've been publishing some on the Effective States website. There are 2 there, and a 3rd one is coming out this week that will bring you up to speed. So with that little context, I want to hand over to Ellen, who will present the findings of the survey.
Is that good?
Yeah.
Okay, perfect. So I want to start by, first of all, thanking you and thanking Marja and Cesar for joining us in this project, and all of you for joining us on the webinar. What I want to share with you are the results of a survey that we've done together with SAIPAR that's really looking at a wide range of questions around COVID, questions about health and sort of how people are responding to the crisis, how they're sort of behavioral responses, but also questions about the kinds of challenges that they face. And the survey was done, as you can see here in the map, in the area around Lusaka, and then in the area that's on the border, the Malawi-Zambian border. The reason for choosing to do the survey there was that this survey is a telephone survey using numbers that we had collected from a research project done in 2019 that was aimed at understanding how local governance takes place and varies in the urban areas, along border areas and across different communities. So that survey, the Local Governance Performance Index, or LGPI, basically asks a series of questions about how people participate, where they turn to for help if they have problems in education or health or other types of service provision, the levels of service provision they get, their experience with things like informal payments, etc. And it's heavily clustered, so we do it in a series of communities, which means that that we have information about the communities in which they're embedded, as well as information about the individuals that we talk to. In that survey, we had about 3,500 respondents, and we had collected phone numbers from a number of them. And from those phone numbers, we had about 5,000 respondents and 3,500 phone numbers. And then we used those phone numbers at the outbreak of COVID. We decided we had the opportunity to be able to shed light on what was happening in Zambia with COVID by basically calling the people who we had already talked to before, collected a series of sort of individual and community level data on, and were able to contact safely by telephone. So it's a telephone survey drawn from a sample that was initially drawn via PPS and sort of geographic sampling that I'm happy to talk about later. We have about 96 variables. We've done 7 reports, just sort of one-pagers that that are available on the website. And again, as Marja mentioned, this is the first of 2 webinars where we'll be discussing this. I want to mention and also thank Ubuntu Research, which was implemented the 2019 LGPI, and then again partnered with us in implementing the current survey. So speaking first about the sort of what we've learned about vulnerabilities and aid in Zambia, and when I say in Zambia, please recognize that we really are speaking about the border area and Lusaka, and we'll talk about some of those issues if you'd like later. But basically, the first thing we looked at was just what's the extent to which we have vulnerabilities in the different areas or sort of among the population. We consider to be a vulnerability if you lived in a multi-generational household, that was young people and old people living together. If there were a household with more than an average of 2 people per room, on the idea that that was a place where it was harder to self-isolate. And then if you were living with somebody with a pre-existing condition. So those were the sets of questions that we were asking. And at least, again, of having at least one of those were about 60% of the people. And then, of course, of having about 3 or more of those, we find it's about 16%. So some people, of course, facing multiple sets of vulnerabilities. We also were interested in whether or not there was sufficient access to water and soap and sanitizer for people to keep sort of safe through frequently washing hands. Approximately 1 in 10 don't have enough access to either water or else to soap and sanitizer to wash their hands for their family, right? So that was the way the question was asked. And we find that this percentage is the highest in the Eastern Province. You can see in the maps to the right, basically where it's dark green is the sort of highest percentage of people who are unable to have access either to water or else to soap and sanitizer, which is the lower panel. And that's about 18% in the Eastern Province, and then less. Where it's gray, by the way, just again to remind ourselves of the nature of the sample, are the areas where we don't have enough information to really make make informed sort of assessments. The other thing that we've looked at is the questions about income and economics, and of course we've just seen statements out about how economics is really the ways in which the coronavirus seems to be most harshly hitting sub-Saharan Africa. And what we find is that about 68% of Zambians say that they don't have that their income does not meet their needs. So that's just a first sort of take to recognize that there's already a sort of sufficient, a lack of sufficient income. And of these also happen to be the people who are most vulnerable in the other ways that we've thought about it, right? So the large number of people per room lacking sort of water, soap, and sanitizer, having pre-existing health conditions. They come in bundles, unfortunately, for various populations, and again, mostly concentrated or more highly concentrated in Eastern and Central provinces. Then we look at the question about economics and gender, and this is this takes a little bit of thinking through to make sense of it. If we're simply asked, if you've lost a job, if you've lost hours or lost income, we find that about 16% of men and 14% of women say that they've lost jobs. About 27% of men and 20% of women say that they've lost hours. 44% of men and 42% of women say that they've lost income. That would seem to mean that there was sort of approximately the equal impact of the economic sort of and financial stresses of COVID on both men and women. But it's important to remember that women to begin with are about half as likely to have jobs as men. We find that from the very beginning, the 2019 survey. And so what that really means is that if women are less likely to have jobs to begin with and still 14% are losing jobs, that we're really looking at a higher impact on women with jobs than we have an impact of men with jobs. So the kind of the change or the stress that comes from an economic perspective is likely to be worse for women. We also find that the more highly educated are more likely to have lost jobs and to experience reduced hours. Again, this is partly because the more highly educated are the ones who are more likely to be in the types of jobs where you can have hour reductions, or you can have a loss of income. So it's partly about the economic structure and the sort of the employment structure, but it's useful to keep in mind that that is the population. So we have basically about 48% of those with post-secondary school education losing jobs versus about 35% of those with little or no schooling. We also then find a pretty significant gap between the need and then the receipt of assistance. So about 43% of Zambians say that they're in need of assistance, while only about 16% say that they've received assistance or received help. Again, we find this sort of a particularly strong gap and notable in Eastern Province, where nearly 50% are saying that they need assistance, and far less than 20% are saying that they've received it. Machinga looks very much the same. So across the board, again, we find that there's this kind of this gap. And then we also find that those with higher education are more likely than those with less education to receive assistance, although they're actually only equally likely to need it, right? So while everybody needs assistance, those with more education for whatever reasons are more likely to be able to access and to be able to obtain it. Finally, when we look at just the question about where people turn to for this type of assistance, we find that they turn to family and friends the most. About 31% are turning to family and friends. They're turning to healthcare workers, employers, members of parliament, and religious organizations are sort of at the tail end of who they say that they received assistance from. That was an open-ended question in the sense that we simply said, from whom did you receive assistance? And we didn't sort of single out a set of actors that they were to choose from. So that's, again, those are the findings that we have from with regards to just the kind of the questions about how widespread are vulnerabilities, where do they, where are they sort of concentrated, where do they seem to be kind of most clearly evident, and the nature of them. I wanted to stop there for a minute in case there's any questions or any, if anybody has any questions. And I'm going to try to figure out how I can do this at the same time.
Yeah, I can look at that, Ellen. So far, no questions. We had one question about the source of the serological analysis source, so I shared that online.
Okay, great.
You ready?
I'm going to plug on, if that's all right. So we also look at the question about trust in authorities. And here we've asked, basically, we started by asking whom do Zambians trust to handle COVID the most, right? So who do you think you trust and how much confidence do they have in the public health system and in the government? And what we found was a fairly high level of reported confidence. Northern and Machinga provinces sort of reporting the greatest confidence in the government and public health system. And again, the expectation being that they had the capacity to fight COVID. We also then asked about levels of trust in different sets of authorities. These are levels of trust overall. So how much do you trust each of the following? And then we also give them the option of, or haven't you heard enough to say? That's a question that's also used in the Afrobarometer and other places. So it's a quite standard way to ask about general trust. We find that there is fairly high levels of trust for governments, chiefs, religious leaders, provincial ministers, and district health offices, which is what we were asking about in this set. We find, of course, I don't know if it's of course, but we find that the level of trust, or a lot of trust, is highest for the religious leader and to some extent the district health office. It is the sort of lowest or lower for the provincial ministers, which is, I think, quite interesting. And then people with lower or no education tend to have greater trust in the government and their chief than those with more education, something that we see not only in Zambia but elsewhere as well. Then we ask about who do they think understands COVID best. Basically, by far, everybody thinks that the health officers understand COVID best, which means that people see this very much as a medical health problem, and see the health services as the appropriate authority to deal with it. We also asked the question about who had the right to sort of try to place restrictions, and this was done through a survey experiment, which I'd be happy to share more details with later. and which actually has been the Malawian sort of counterpart of it has been published. But basically, we were interested in understanding the extent to which you might be more likely to get compliance depending on what kinds of activities people were asking for, and particularly thought that maybe religious leaders would have a greater ability to get people to say to refrain from large gatherings, particularly thinking that they are in part religious gatherings. We find actually that the chiefs and the district health officers are the ones who are seen as having more of a right to be able to sort of put in place or to ask people to sort of comply with various restrictions, those being about hand washing, staying away from gatherings, and staying home. We've, of course, not surprisingly found that people were much more likely to say that they would wash their hands or stay away from others than to stay home. But then we also find that really while both district health officers and chiefs were able to ask, it was really only the chiefs who could sort of gain extra sets of compliance. So people were most likely to comply with their chiefs than even with the district health officers' sort of appeals for compliance. I think that's important, and just in terms of thinking about how information might be put out, and also thinking about what types of authorities might be able to sort of gain the most sort of results. And then I think finally it's important to recognize that while we saw sort of fairly high levels of trust and the sense that the authorities understood and can comply with and can sort of lead the effort to combat and respond to COVID, we also find that a lot of people sort of fear the exploitation of COVID by politicians. So 71% of Zambians said that they fear that politicians will use COVID-19 to gain power or to enrich themselves. And again, a little like the trust in authorities was higher for those with lower education, and now we find that the people who are more worried about corruption are those with higher education. Right? So there seems to be a more general sense of concern or worry from those with higher education with regards to the authorities' ability and to lead the process. So then again, I just wanted to share those sort of highlights of the results with you. And to thank you for joining us, and I look forward to the discussion. There's also the website address in case you want more information. But note before we continue that this research has been funded by the Swedish Research Council and Formas, who thankfully had given us a fairly large grant before COVID struck, and we've been able to use it to support this work. So thank you.
Mm-hmm. Right. Ellen, there are a couple of questions that have come in now. So maybe let me start with the methodological ones. Mm-hmm. One question. The DHS to determine income vulnerability.
I'm sorry, you cut out at exactly the point of the question. One more time.
Okay, sorry. It was, did you use the standardized quantiles used in the DHS to determine income vulnerability?
No, we use a question that basically asks whether or not you have enough income to cover your needs, right? So the question itself reads, would you say that you have enough income to save, to meet your needs, to easily, sort of less easily, and not to cover your needs? That's the question that's being used here.
Okay, I think Maya had frozen a little bit. The second question, Ellen, is what was the geographical distribution among your respondents in terms of rural versus urban?
Yeah, so we don't have a rural versus urban marker itself. I think if I remember correctly, and Erica, if you want to chime in, you're very welcome to do so. Erica's our statistician and has also worked with us on this. But it's about 50-50 in terms of Lusaka and the border region. But that's not exactly the same as saying what is rural and what is urban. Let me also explain that the way that the survey was done initially was it was stratified. So we used a sort of distance from the border. We have basically up to 100 kilometers from the border, 0 to 50 and 50 to 100 strata. And then we are looking at sort of a circumference around Lusaka Center, which is with a 50-kilometer radius. So that's the geographical area.
Mm-hmm. Yeah, I think I'm active now again. Sorry for that. Another question was, are there active cases high among those considered vulnerable according to the study?
That's a really good question. That's a question we can have by the sort of health webinar. I don't remember the answer to that offhand. It's also something, if anybody wants to email me at the end with additional questions, there are things we can check.
Okay. And then a question about the trust of authorities to handle COVID in terms of like educational levels or other demographics.
The trust to handle COVID?
Yeah, which groups of people are most likely to trust religious leaders to handle COVID?
Yeah. That's a really good question too. I don't remember anything that was a significant difference in terms of willingness to trust COVID according to education levels or actually other markers. It's one of those other things that we could look into in more detail, but there was nothing that jumped out. The main findings were the ones that we've sort of put forth are those that were the most notable.
Mm-hmm. And then a question from someone who specialized in social cash transfer. So she's asking, what kind of assistance are you referring to when you ask the question, who's assisting you? Is it mainly financial? And also, can you share specific figures for trust in government? It looks like it's between 50 and 60%, but it would be good to have the exact percentage.
Okay. We can come back with the exact percentage, but in terms of the question, what we asked initially was, did you need assistance? And then we asked what kinds of assistance that they needed, and then whether or not they've received assistance. So we didn't ask, do you need a financial assistance, and then whether or not you got it and who you got it from. So that's so some of the assistance. I mean, what we saw were people needing health assistance, financial assistance. There was a lot of people getting assistance with getting masks or sanitizers, for instance.
Mm-hmm. And there was a comment which I think is also quite useful. This is someone who works with local authorities, and they say they're currently running a rapid assessment survey on the preparedness of local authorities to deal with COVID-19 and other related conditions. Local authorities run public health departments and deal with public health responses. Maybe it's something we can think about in the next round of surveys.
Okay, at least for me, I think you cut out right at the point where it was again the key point. Do you want to say that one more time?
All right. Yeah, so the local authorities are quite active in dealing with COVID-related issues. So they thought it doesn't come out as a category, in the trust issue. Yeah. So then I thought maybe it's something we can consider when we're doing the next round of survey.
That's a great idea.
Yeah. So this was just a comment. Another one would be, could you please elaborate a bit? Sorry.
No, I just wanted to say that's a great comment, because the next survey actually is much more aimed at understanding how within communities how people are responding, right? So it sort of takes a closer dive at the local community level. So that would be very useful.
Then there was another one. Could you please elaborate a bit more on how the survey experiment regarding who have the right to request COVID-19 restriction was conducted?
Yeah. So the experiment itself, it was just a very short survey experiment, because it's also in a telephone survey. So we basically we asked, we have authorities, so we were randomizing between religious authorities, district health officials, and sort of the chief. And then we had a question about, and we randomized between the actions. So we basically said, your district health official to one person or your chief to another person is asking you to, wash hands, or is asking you to stay home, or is asking you to refrain from large gatherings. Then how likely are you to do this, and how likely do you think others would be to do this? So we're able to use that as a way to understand, kind of on average, when people got the sort of the religious leader versus when they got the chief, how much were they likely to say that they would stay home or would not stay home. So that's the way that the survey is done. And then there's follow-up questions that are things like, do you think this person has the right to ask people to do this? Do you think that this person will be listened to by others, etc.? And again, the World Development, the latest World Development, has published the sort of the results from that experiment that was done in Malawi as well. So you might be referred to that to see that kind of experiment.
Mm-hmm. Another methodological question is, since the survey was stratified, did you consider multi-level biases in the analysis?
Since the survey was what, I'm sorry?
Stratified?
Mm-hmm.
Did you consider multi-level biases in the analysis?
Yeah.
Mm-hmm.
So it's not a multi-level analysis, to be fair, but it is. We are using in the main LGPI, when we analyze it, we're able to use the sort of survey weights that are survey design weights and population weights. In this case, we actually, Erica, please sort of chime in again if you see this differently, but we're not using the weights in this analysis.
Correct. Yeah, this is not weighted. I mean, these are barely, I mean, this is not a modeling exercise at all. These are really just initial exploratory findings. Another thing to know is that the original sample was stratified and multi-level in a very specific way. However, about half of this COVID sample are actually replacement respondents, where a different individual answered the phone, and often they lived outside of our original sampling frame. So it's a little fuzzier than the original one, but definitely if you're trying to make some more specific claims, that would be a good idea to incorporate the structure a little bit.
Thank you. The voice behind the clock.
Yeah. Thanks, Erica. So the next question is about, are there any insights from the survey on the perception of the adequacy of existing social safety nets, and how these have been able to assist the most vulnerable in coping with the effects of COVID-19? This is going back onto the conditional cash transfers.
So we don't ask specific questions about any of the sort of ongoing programs themselves, right? We're not asking about, we don't even ask a specific question about whether or not they've actually gotten a cash transfer through an existing program. That's again something we could do in the future, but we didn't do it in this case.
Then somebody else is asking, do you have any additional data on the Zambians who experience reduced hours and loss of income when it comes to their expenses and spending habits? For instance, is their income sufficient for their living expenses, as they're living off savings now? What expenses, investments do they decide to postpone?
So one of the tricks about the telephone surveys is that there's only so much that you can ask, right? So these need to be fairly short. So again, these are one of those cases where what we've done is we've gotten sort of a snapshot of kind of a range of issues that are out there, but we haven't gone into great detail about spending patterns or how people are sort of managing to make ends meet in the case of reduced hours and wages. So the short answer is no. The longer answer is that. So.
No, I think it's something, we've been thinking of expanding the project, also depending on funding, to get into more detail like that. Yeah. And the last question, before we move on to Cesar, is it would also be useful to get the misconceptions the respondents have about COVID, as these might pose a barrier in public health initiatives aimed at COVID.
So we do that with to some extent with some of the questions that we asked about, health behaviors and precautionary behaviors, and questions about how they see, even sort of what are symptoms of COVID. We don't necessarily ask those in the questions that we've highlighted here, but we ask them in other parts of the survey. I agree, it's important to understand that. Yeah.
Yeah. Is that something that will come out in the next webinar, maybe?
I think that some of that can come out in the next webinar. Yeah.
Mm. This is more policy question. I'm not sure if we leave it for now or for the panel discussion. What policy recommendations and suggestions to development partners would you derive from your data?
Let's come back to that. Not because it's not an important question, quite the opposite. I think it is, and that's why we're going to sort of save that last section to thinking through that together. That sounds great. Okay.
I'll note it down to make sure we get back to that. Right. Okay. Thanks very much, Ellen. With that, maybe I can hand over to Cesar, who will be discussing more the economic and policy aspects of COVID-19.
Thank you, Maya, and thank you, Ellen, for that wonderful presentation. I would like to begin by echoing Ellen's words and Maya's words. Thanks to everyone that's joining us for this webinar. We know your time is valuable, and we really appreciate you taking the time to join us. Maya and Ellen, thanks for the collaboration with ZIPAR. Thanks to ZIPAR as well, because much of what I present here is just a combination of different pieces of work that ZIPAR has been doing. And I'm just a mouthpiece, and there's a lot of smart people that somehow make me look smart. So thanks to ZIPAR for that one. I'll just go ahead and share my screen just so that we can follow along. So in this session, the idea is to try and understand a little bit of the macroeconomic, health and public policy context of COVID-19 in Zambia. So we are switching it up a little bit. We were looking at some microeconomic issues to do with what's happening at the community, what's happening in families, households, and so on, what their perceptions are with Eleanor's presentation. And now we sort of start to look a little bit from a bird's eye view, what is going on. I will try to be quick so that I can give sufficient time for questions and answers. In terms of quick outline, that's what it looks like: macroeconomic situation before and during COVID, the health trajectory, how it has panned out from an official point of view, and then also look at some policy responses around health and social sectors, around economic sectors, as well as macro policies to do with monetary and fiscal policy. The first thing, I think, the big one is clearly there's been a significant downturn in the Zambian economy as a result of COVID. That chart is looking at GDP growth rates as well as per capita GDP growth rates, the light blue and the dark blue lines. And you can clearly see it. While the Zambian economy was in a downturn since 2010 in terms of reduced growth rates, things have really come to a head under COVID, and the estimation is that the downturn will be much deeper. Economic stabilization also is sort of coming under threat in the sense that you will notice that the exchange rate instabilities, the inflation instabilities that have been there inherently in the Zambian economy over time are actually deteriorating a lot faster now with the advent of COVID. But like I said, many of these problems have been there even before COVID. And one of the big challenges that Zambia has faced is the fiscal expansion to finance infrastructure development, which has persisted for a long time, since 2012. The idea behind all the deficits, all the borrowing and the mounting debt was really to help the economy to grow. But I think in terms of outcomes, the years of borrowing and high spending have actually created the opposite. And basically that's what that chart is saying. So debt has mounted, fiscal deficits have deepened and are quite off target, and this is a significant problem. So getting into the COVID situation, how has Zambia fared in terms of the COVID outlook? These are the official numbers and the official outlook. This is up to date as of yesterday. And one of the striking things for me is how significantly strengthened the health institutions, health systems have been made around COVID. You can see we are up to date. Probably now they've been published statistics for today. This is quite at variance with what's happening in other health conditions in the health sector and so on. But with that, recovery rates are high, 94% as of yesterday. Active cases have dropped significantly. The case fatality rate is at about 2.2%, lower than the period average from April to October. The curves you can see in terms of new cases in the last 7 days, that has flattened going into September, October. The recovery rate has been ahead of the new cases coming online. The death, maybe let me flip the chart a little bit and let's read the red line of the right axis of that chart. And it gives you a better perspective of what's happening in the area of case fatalities. And you notice that there was a spike in July, middle of July, another spike in middle of August, and then a third spike, not so much, but another one in middle of September. So it looks like there's a cycle going on there. By the end of the period, case fatalities are very low, less than one case in the last 7 days on average.
Why have we lost him?
I think we give him a second to log off, log back on. Maybe.
Sounds good.
There we go.
There he is. Okay.
I'm sorry, I think I had gone offline. I would just backtrack a little bit. Let me just share my screen again. Sorry about that. I was saying new tests, new cases per 100 tests are declining. So there was a peak period where for every 100 tests you would do around 12th of August, you'd find more than 25 people. But now towards the end of the period, for every 100 tests you do, you're talking about probably 2 to 5 people on average in the last 7 days. Again, a big disclaimer is this is from official statistics, and this is what is being published by the Zambia National Public Health Institute and the Ministry of Health. So what are some of the responses that have been responsible for this on the health side? I think there's been a legal basis, a COVID statutory instrument that was instituted. A lot of guidelines on masking up, on social distancing, hand sanitizing, on the practitioner side, contact tracing, quarantining, and things like this, as well as case management issues and resourcing. A lot of the health side interventions have been heavily supported by cooperating partners, the donors. Other interventions on the social side, as well as touching a little bit on the economic side. Schools had been closed but have reopened now. Churches had been closed but are reopening. So a gradual reopening of the economy. Some key programs like social cash transfer at the top are still facing funding challenges, particularly because of the fiscal constraints that I mentioned earlier on. Moving into the economic sectors, I think one of the big ones that is on the radar of the fiscal authorities is the agri sector, where in 2020 and 2021, we're seeing a ramping up of support to the Farmer Input Support Program, as well as to strategic food reserves under the Food Reserve Agency. In other sectors, there hasn't been that much relief or support, clearly because of the fiscal constraints that have continued to obtain. And many of these sectors, if you think about tourism, if you think about manufacturing, other services and so on, mining, they've basically been left to fend for themselves because of the fiscal constraints. And there's some sort of losers when we're looking ahead to 2021 who will not receive adequate funding because of the lack of fiscal space. Finally, at the top, when you're looking at macro policies, one key policy on the monetary side has been the Bank of Zambia's 10 billion facility, roughly 525 million, to stabilize and to strengthen financial markets. Quite a bit of misunderstanding about what this facility was for, and a bit of a backlash there. In terms of interventions in the exchange rate, these have been minimal. The Bank of Zambia has kept to the game plan of trying to smooth volatility or fluctuations in the exchange rate. And over the long term, because of the structural imbalances in the economy, the kwacha has continued to slide. The big one, as usual, fiscal policy. One of the measures has been to mobilize and issue a COVID bond, about 8 billion kwacha, the equivalent of $439 million, which means more borrowing to contend with COVID. So the debt is still with us. Another idea was to seek a debt moratorium from the G20 group. I have their question marks because I'm not sure whether Zambia secured this standstill. And it's also not very clear what the ex post plan for resuming the payments once the standstill period comes to an end, what the plan is. In terms of the IMF, the rapid credit facility was essentially a no from the IMF, with the IMF essentially saying Zambia's debt was not sustainable and we needed to get back our debt on the path to sustainability. Very recently, the Minister of Finance was in consultation with Eurobond investors for another debt moratorium or standstill. But the response there again was a no. And one of the concerns is, what are you doing with China? Are you seeking a similar moratorium or standstill? And I suppose that's one of the things that the authorities now have to contend with. But all in all, the Zambian economy faces significant fiscal risks, which touch on the rest of the economy more broadly, getting into the fourth quarter of 2020, as well as getting into 2021, those are unlikely to go away. So COVID was just a tip of the iceberg in terms of the macroeconomic outlook, but what a tip it was. When you look at the curves, it was by no means a trivial matter. COVID has really significantly caused a knock-on effect on the economic side of the economy, while the health side has probably been dealt with reasonably well in Zambia. The economic side is still going to be a challenge to rebalance the economy and stimulate stability and growth. Essentially, that's what I had in terms of the outlook, and maybe I'll pause here and hand over Ellen, Maya, if people have questions. I think now would be a good time to sort of see what could be said about this outlook.
Great, thank you. Thank you very much. This is incredibly interesting. So yes, I want to open up for questions. If you want to put them into the Q&A chat, I'm happy to read them out, and maybe we can sort of, while people are also gathering their thoughts, start with the question, which is the question about the policy recommendations. And Cesar and Marja, maybe you want to take the kind of first thoughts on that.
Well, from my perspective, I think in terms of policy recommendations, I think there are two sets. There are many elements that at the macro level, how do I put it, need to be sort of tracing the steps backwards and seeing where have some of these negotiations, for example, on the fiscal side with different creditors, where have they gone wrong? And how do we get back on track? Because definitely this is something that the Zambian economy needs, which the authorities are already trying to address. And there's a somewhat of a catch-22 on the issue of debt negotiation. And that is the balance between providing information transparently in line with what would be required of you, and holding information back so that you have a stronger negotiating position with your creditors. And I think the authorities have tried where they can to offer information, and where they can try to withhold information so that they have a stronger negotiating position. But I think that's one of the messages is keep trying these different options, and particularly trace back your steps and figure out where some of these things are going off track.
Thank you. Marja?
Yeah, sorry, I'm trying to open my screen. Yeah, for me, I mean, it's not really my field, so I'll keep it very brief here. I think for me, the very interesting thing was the issue of trust in authorities. And I think that's where a lot of things can be done in terms of how do you get information to people. I would have expected that more authorities would have had influence on this debate. And the fact that it's very much geared still towards the health, whereas the problem seems to be much broader than that. There seems to be a lot more space in, you know, that more authorities can use their influence to create awareness and support the problems that people are facing. So I think that's a role of civil society, as well as donors, as well as governments. You know, there seems to be not everybody's being reached on all of these issues.
The other part about not everybody being reached, something that strikes me, and I'd be interested in your reflections, or if others want to sort of join in the Q&A part on this, is this question about almost what seems to be an imbalance between, you know, potentially the people who are sort of kind of most vulnerable and most needy, and then where the resources seem to be going. And maybe that's, again, I know Zambia, at least of the three of us, but you know, maybe that's a misperception, but it does seem to be what at least the survey data suggests, right? That you have these sort of, you know, sets of households where they have multiple vulnerabilities, they have a lot of sort of problems, and yet, you know, when you look at where they're not the households that are, you know, kind of the most, you know, where the most well-educated are, et cetera, but they're the ones, so they're also not the ones who are most disproportionately likely to get assistance. Again, that's at least what the data seems to suggest. I'd be interested to know if that seems to be the case, or how people, you know, how that's seen. Okay. We have a couple of questions as well. One is, has FISP or FISP improved in terms of targeting, timing, and results? This is a bit the same thing. And has it seen, or is it still seen as a politicized program? The FISP budget seems to keep going up even when the fiscal space is limited. Cesar, do you want to take a stab at that?
Yeah, sure. I think to be perfectly honest, going into an election year, it's very hard to avoid this aspect of programs being seen or perceived as politicized programs. In this year's budget, 2020, FISP was at $1.1 billion, kwacha. And in 2021, it's been programmed at 5.7 billion. So just that jump makes it very hard for people not to think of it, considering the time of the elections, not people to think about it as a probably politicized program. In terms of the targeting, timing, and results, I'm not 100% sure. I think myself and my institution haven't done that much work for us to have a very strong empirical perspective on those things. But it seems like this is a recurring problem that has been there. As far as we know, the program, other than going e-FISP, hasn't been reformed significantly. I think the issue has been to just increase the allocation.
Thank you. There's another question that says, it's interesting how you're separating the impact of COVID-19 on the health and the economy. One tends to think that these two are exclusive. Could there be a relationship between health and the economy in this context? and any chance that the health benefits would impact the economy positively?
That's a really complicated question. It's a really good question. I think the relationship is very complex. I mean, there's a direct impact on the health side, which is the disease burden and how that takes a knock on the health sector. Fortunately, in Zambia, like I was saying, recovery rates are very high, and they're keeping ahead of the new infections. So the case fatality rate has dropped significantly. And so the health side is sort of insulated. But remember, because of the uncertainty that COVID created in terms of how do we manage, how do we treat, the response varied across countries and within country, and it was like an experiment. So it included a number of restrictions, many of which touched on the economics of things. And so it's not surprising that the survey, for example, speaks the same language on income perceptions as what we're seeing in the macro numbers on income drops per capita, right? So it's the same story. And that is probably a significant sort of telltale sign that with uncertainty about the health status of a society, economic activity goes down, and with economic activity going down, welfare and fortunes also have gone down, including income. So yeah, there is a link, but I think it's very difficult to sort of compartmentalize it and sort of put it linear that way, as you would say. It's very multidimensional, and it's quite complex. But yes, there is.
Excellent, thank you. This, I think, is right up your alley, since I understand you were just looking at this closely, but it says, do you have any insights on which aspect of the recently presented 2021 budget can help to cushion the impact of COVID on the Zambian economy?
Can I just dodge that one like a Zambian politician and say, incidentally, what's happening is very soon ZIPAR will be launching its budget analysis. And I would encourage everyone here and everywhere else to keep your ear to the ground. It will be quite widely publicized. We're doing the launch in collaboration with the Ministry of National Development Planning and the Ministry of Finance. And I think some of these nuanced questions about what's in the budget and how that helps to respond to the COVID pandemic, as well as more widely to the economic headwinds, those issues would be better addressed in that platform.
So that's a stay tuned answer.
Yeah.
There's a question on the economic outlook. It says, do most recent Zambia forecasts take into account changes in global forecasts? For example, the commodity demand from a possible China rebound? And to what extent can any positive external circumstances improve Zambian outlook at this point?
As far as I understand, another really good question. As far as I understand, to some extent, those are taken into account. I know, for example, the 1.8% growth outlook for 2021 is based on what the Ministry of Finance pronounced in the recent budget statement. And as far as I understand, that came from some detailed work that takes into account some of these movements. But the challenge is the movements themselves at the global stage are also quite dynamic. If you remember, when the pandemic was starting in Africa, people were anticipating catastrophes, dead bodies in the streets and things like this, but that didn't happen. And so assumptions around that had to change. Now people are anticipating a commodity boom, including copper price rebounds. That could help Zambia. But how reliable? I mean, we don't have a sufficiently reliable crystal ball in which to look and actually get the answers. It's, I guess, half and half. You work with the data that you have, you work with the information that you have, and you make the best guesstimate that you can. And when circumstances at the global level start to change, you quickly regroup and try to change your assumptions and see what the outlook looks like.
Thank you. Thanks. It's actually, in a sense, it's kind of the broader sense of uncertainty, right? I mean, that we're all dealing with, whether we're talking about it from a health perspective or an economic perspective. It seems to be like that's the kind of the common denominator, and the interlinkages that were raised before. So I think that's what I have in terms of the current questions on board. Do you have other sort of messages that you want to make sure are out? And another thing I would like to sort of invite participants to do, because this is one of the things that we wanted to have a discussion of, is not only to sort of ask questions, but to pose your own thoughts on what you see as the policy recommendations or what you see as the implications of the messages that we've uncovered. And so sort of invite people to sort of put their thoughts in the Q&A as well as again to ask questions there. But Marja and Cesar, in the meantime, any things that you want to make sure our message is out?
I mean, for me, I think it's the stay tuned message. I think there's a lot more that's coming, both from within this collaboration, from GLD, future surveys, as well as from ZIPAR, the ongoing work. I think if interested, all these resources will be made available, and as well as follow-up links. So if people have ideas of some of the areas, particularly where we have gaps in our analysis, where we have gaps in our thinking, it would be really appreciated if we could interact. I think all of our institutions are learning institutions, in a sense. They're quite dynamic, and it would be good to get beyond just the Q&A type of questions, to get some feedback of what are the issues that are on people's minds, that are of interest, that we could pursue and put the information out there in a consumable way as a public service to Zambia, to the region, and to the world. That for me, that would be my main sort of message.
I think another thing we looked at was, it would be good to have an overview, like ZIPAR has done, with an overview of all the policies that have, government has taken. It would also be interesting to have an overview of the non-state actors, what initiative they've taken and what the impact is on that. And sometimes we operate in silos. We don't know what initiatives are out there. And I don't know if anyone in the audience knows if there's an overview of all COVID-related projects, COVID-related research, and thinking about how could you possibly measure the impact of those initiatives. Also realizing that it's a learning process. A lot of it is being experimental. But in a few months' time, maybe we can say more about that as well.
No, that's a great point. And this question of just being able to kind of canvas, what is being done on the various fronts and levels, I think is a good starting point on that. We had a question in about what roles have digital technologies played in the recovery, and what roles do you see them playing in the recovery efforts going forward? And I would just note that it seems to me like this is one, I mean, I'm not saying that this is sort of the recovery effort, right? But it has definitely become an important part of making it through this, right? I'd sort of think, okay, when people make those comparisons to the 1918 flu, that's a great comparison, but nobody was Skyping and Zooming meetings and still sort of be able to kind of keep going in some of the ways that we are today. But that's my own sort of reflections on that question. I don't know, Cesar and Marja, if you have anything else that you want to add in that regard.
Marja?
I'm sorry?
I'm definitely piqued by your question about the comparison with the 1918 flu, because I'm an historian, so it would make for a very interesting paper to make a comparison about the response from the flu in Northern Rhodesia in 1918, because it had a massive impact. It also overlaps with the area where the hotspots are now, and the way that the health messages were carried out. And so, one of the aspects would be high mobility been aspects, and this is particular with the First World War ending, and soldiers coming back from the front in Tanzania, back into Northern Rhodesia, carrying flu with them. But like you said, I mean, how was the messaging done by government? And there we see discrepancy between the African population, where the death rate was very high, 5 to 10%, and the Europeans very low. So clearly there was a, description in terms of race and class, who was having access to information and treatment. And of course, that's something we have to keep in mind for this epidemic as well.
No, and I guess in some ways, I mean, on this one, that's what we're getting to a little bit when we're thinking about who can get aid, et cetera, right? And certainly, I'm American, so thinking about how it's affected different classes in the States has also been a big thing. But yeah, that would be fascinating. So, but I actually echo both Marja and Cesar what your suggestions about, if people want to, follow up with additional questions, but also really with additional thoughts about the kind of gaps that gaps in knowledge more generally, and resources, right? Sort of what is out there will be extremely helpful. So yeah.
Yeah.
Right.
Great. So I think since we're through with questions, maybe we can briefly talk about what are the next steps of the project.
Cesar, do you want to start, or you want me to?
No, absolutely. Ladies first. Please go.
So we're actually about ready to, hopefully at the end of the month or early next month, we'll be fielding the second survey. So we have at least one more planned, and then it will depend, I think, on kind of resources. We don't have anything planned after that. The next one looks a lot more closely at these questions about how communities are actually addressing the challenges, and trying to think a lot more about the sort of kind of community level initiatives and variations. And in that way, what Marja was saying about sort of the possibilities of having a kind of a canvas of what is existing and where, and not only what, but where different initiatives are taking place would be extremely helpful. We'd like to continue the collaboration, and we've, so this is a world of needing to finance work, right? So, we put out a number of kind of proposals for grants that would finance that. But so far, the sort of the next plan and the next step is to look at the kind of the more local response at the end of the month, going back ideally to those same respondents that we talked to before. So that's what we have on our side.
Thanks, Ellen. If I may, on the ZIPAR side, I think, like I said, to steal Ellen's words, just stay tuned. I think for some of the highlights that have been shown off here, there's a lot more that is coming from in terms of the budget analysis. We're also doing some work for UNICEF and UNDP that touches on a number of these aspects to do with the COVID impact on health and other social sectors and things like this. So we will keep people readily posted. I think for me personally, one of the areas I would really appreciate to hear is the sort of collaboration that participants, those of you who have been able to attend, did this make sense to have a transition from a sort of micro analysis, households and communities, all the way to the macro? Or was it a bit overwhelming, in which case we want to break it up a little bit? But I mean, the feedback would be really tremendously helpful for us to figure out how to organize our webinars a bit better and connect with you all in a more relevant way. But yeah, no, I mean, a big thank you to everyone who's been able to join in. And Marja, as well as Ellen, thank you for the collaboration and the great teamwork on the webinar.
Thank you. Marja, any last words on your side?
Yeah, no, I think, it's an interesting question that you put, Cesar, at the end, if it makes sense for, the different, the macro and the macro and micro levels. And at SAIPAR, we're currently involved with ODI on the political economy of their poverty studies. And again, it ranges from, kind of micro level interviews and data to regional to national level, and trying to make sense of it and trying to connect it to. But I think without a context, it would be very difficult to understand what's happening and how people are responding to some of the issues that we find in the surveys. I think there's still some few questions that have come in. If Ellen still feels like, I think that's an important feedback to the panel. Is like, if you're open to the inclusion of additional questions from external collaborators in the next round of the survey.
Yeah, you can reach out to me and we can discuss that. It's always this balance between time and time and space, but I'm happy to talk about it. Then we will need to create space for utilization of these findings. That is a good question, and that's also another place where I think that at least I could always use suggestions in terms of how to get things from, kind of from research and knowledge to the right hands. This obviously is one effort at trying to do that, but others are very welcome, or other suggestions are very welcome.
Yeah, and I think the presence of ZIPAR being here, because they're more linked to government in any case. So, but yet to reach out is important. I think there's another remark about, well, complimenting that's a good webinar, and only found out via LinkedIn feed. So what are the means we're going to communicate the next webinar?
Yeah. So we could actually, we have the list of those who've signed up for this one. So one thing we will do is send out a notice, hopefully nobody won't feel spammed, but send out a notice with the next webinar link in that. Otherwise, at least GLD, if you sort of go into the what's the word for it? But like the website, you can sign up for the newsletters, and then we make them available that way. We sort of Twitter them out and other ways. Marja, I don't know if you have other things to add on that. No, I think we'll use all different means. Like we said, we've got all the digital technologies available now, so we'll use the whole range as well to attract. The next one will be more health related, so possibly also a different section of audience as well. Then we have, do you know if there have been any regional differences in implementation of the policies mentioned? Not only with regards to COVID-19 restrictions, but also scaling up of FISP or SCTs, etc. Cesar, I think that's in your bailiwick.
Yeah, that's an excellent question. I think the short of it is no, I don't know, and this is definitely something that myself and colleagues at ZIPAR, as well as other institutions, I think EAPRI and others would be very interested to see if there have been any significant differences regionally. So we can definitely put that on our agenda and think about it in terms of study for another day. Not in the next 2 or so weeks when we're disseminating what we have on the table right now, but maybe for the future.
Great, thank you. Thanks. Great. Do you see anything else? It's always hard. I always find it hard to even know where to look.
Yeah, Ellen, I don't know if it's a possibility. There's so many questions on social cash transfer, if that could become a question in the next survey round.
Yeah.
At least one of the specific answers that could be given to differentiate between the different kind of assistance people are getting, since there's been a bit of upscaling of social cash transfer.
It would be great to know from those involved in the program itself, or is also sort of where those targets and what's been used as criteria for targeting, right? Mm-hmm. So that we could start to, both in terms of framing the question, right? Because it would be useful to know who we would expect to be getting social transfers, and also to know where we would expect them to be given. As Erica mentioned, we don't in this case have a database that covers all parts of the country. By the way, the Malawi survey, which we're the second one of those coming out of the field, we actually do have that kind of national coverage. But even here, it'd be good to know where we would expect and what types of people we would expect to be receiving cash transfers. So yeah, if anybody has information, please reach out with that. That'd be good. But yeah, I agree. I mean, and this is again the kind of information to follow up on Cesar's call that's very useful. It is a question of, I mean, we have our own reasons for wanting to know about certain things, right? But also to know what kinds of issues are key from the Zambian point of view and from policymakers' point of view is very helpful. So,
yeah.
So talk to us.
Yes. Yeah, no, so this was the first introduction to the group, so I hope we'll have more communication in between, and hopefully for the next webinar as well, so that we, before we get into the second survey related to this. Yeah, so maybe Cesar, you can close the webinar.
Yeah, no, I think it's just to close by thanking everybody sincerely for joining us. It looks like most of the participants that have come stayed the course, and we are grateful for that. I saw a comment about the complications of logging in with different time zones or time differences. So we really do appreciate that you are still here. But as my colleagues have said, I think the main thing is to really stay in touch. We would love to keep hearing from you, both to improve our own research, but also hear what's on your mind and see if we can accommodate that. Ideas about how to put this information in the right hands. I think that's really important. And that's a conversation that maybe just starts here and doesn't end. To GLD, to SAIPAR, again, thanks for the collaboration. And to my co-hosts, thank you for the team effort in navigating the webinar. Our unsung heroes behind the scenes, Erica, Olivia, thank you so much, even for the clocks on the wall that reminded us we're running over time and things like this. But I think it's a really great start, and I hope that everyone that's participating today will see you in the near future on the different future engagements. Unless, ladies, there's something else, I would say good morning, good afternoon, good evening to everyone, or good night indeed for some of us. Thank you very much for tuning in, and we'll see you next time.
Thank you. Thank you all.
Thank you.